We're back, a special edition of our new series, Women's Health Today. This is a summit of sorts on a very important topic.
NBC News medical contributor Dr. Narula brought an issue to our attention that so many women can relate to. Going to the doctor and still struggling to find an answer for a medical problem.
She's been outspoken about this, encouraging women to take charge of their own health. So we're happy Dr. Narula is with us, along with a few women who are going to share their stories to try to help others. We've got Halley Thaxton, Yasmin, Grajales, and Amy Rosenberg. Good morning, all of you.
Good morning.
Good morning.
And Dr. Tara, first, you're coming as a patient, not as a doctor. You yourself had a medical incident that went undiagnosed and unexplained, actually, to this day.
Right. So when I was 24 in my second year of medical school, I noticed something was wrong with my vision. I didn't know what. And I ended up seeing a doctor in Miami, where I was from, who told me I had a visual field loss in the bottom part of my right eye. They thought I might have had multiple sclerosis, and they said, you're going to have brain MRIs for the next 5 years. Another doctor I saw said you might have had a stroke. So there were multiple diagnoses. They couldn't tell me exactly what had happened. They couldn't tell me if it was going to happen again. So here I was at the beginning of my career, worried, am I going to go blind? Is this something that's going to be progressive? It was very scary and challenging, but it taught me what it meant to be a patient and what that fear is like of walking in a gray zone where you don't necessarily have a diagnosis or know what's to come.
Well, that brings us to you, Halley. You had heavy periods when you were younger, such pain that you were throwing up, and you went to doctor after doctor, and you went for 10 years, and no one knew what was up. So tell us about that process for you.
Yeah, so initially when I had first started my periods, the pain was so bad that, like you said, I was vomiting, which triggered my parents to take me to see a doctor who found a very small ovarian cyst, and that was kind of assumed that that was the problem. I was put on birth control. That wasn't alleviating the symptoms, so the dosage was increased to the highest dose of estrogen they could put me on.
Wow.
And then I went years. I had 2 children. I had extraordinary pain every time my cycle would come back after pregnancies, until finally I was, 12 years in, and eventually was diagnosed with adenomyosis.
Now, did you have, I'm not saying female or male doctors, but this is kind of something that women are familiar with. Who was your doctor, and do you think that has anything to do with it?
Yeah, so I don't. It wasn't my experience that it mattered. My first doctor was female, and then I had male doctors. Yeah. I did have a male doctor who I had an appendectomy that was unnecessary. They found that my uterus was enlarged, and they called it boggy, so it was kind of like squishy. And I went to follow up with my gynecologist, and he didn't even do a pelvic exam. Yeah. So it was right after that I found my doctor, walked in, explained what was going on, and it was a shock. He believed me, and it was great.
Yasmin, your situation was different, and you were a young woman, and you were having symptoms, and you were begging, essentially, for a colonoscopy, and the doctors were saying, no, you're too young to have colon cancer. And then what happened?
At first, I was pregnant in 2020 and 2022. In 2019, I had my first episode of blood in the stool. I went to the doctor. They said that I had IBS. I was too young to get a colonoscopy. But I tried to advocate for myself because my grandmother passed from colon cancer. So the episode stopped. I kind of was like, okay, I'm okay. Nothing's happening. And then in 2022, while I was pregnant with my daughter, I started having consistent amount of blood in the stool. And that's when things became more alarming. And I had about maybe 4 or 5 ER visits before the gynecologist said, okay, she needs to go to a gastrologist and
they were trying to say, oh, this must be pregnancy related?
They were saying it was pregnancy related. It was hemorrhoids. Don't worry about it. You're only 30 years old. And I'm like, kids have cancer.
Yeah.
So it doesn't matter what age I am.
And you were diagnosed?
Yes, I was diagnosed 3 weeks after having my daughter in 2022.
With colon cancer?
With stage 3. By the time they found it, the tumor was already...
And it was in your family. I mean, you're in remission now.
Yes.
So glad to hear that.
Okay.
Yes, I am.
Amy, what about you? You experienced some kind of symptoms that are nebulous, I guess, in the beginning, and that can make it really hard to diagnose.
Yeah, I did. I was having headaches, ear pain, some chest pain. It was all very unclear. I thought a lot of it, insomnia too, which was one of the worst parts. And I thought that it came down to menopause. I went to see my gynecologist, and as part of the routine exam, they took my blood pressure, and it was much higher than it usually is. So over the next couple of nights, I just had really bad nights, huge flare-ups of the symptoms, so much so that I went to the emergency room the next day, and they told everything was normal. They told me to follow up with a cardiologist, and that's when I saw Dr. Narula. And from there, I just saw a whole series of doctors. I saw a pulmonologist, a neurologist, 2 ENTs, a hematologist, a rheumatologist. And finally, it seems like there are issues with my neck, musculoskeletal issues that might be contributing to possible migraines. It's still a little unclear.
Well, let's go to Dr. Narula, because we only have about a minute left, but I mean, these are 3 very different stories, and yet you could pull out similarities and lessons. Right. Can you bottom line it for us, what women can take away from these hard-earned lessons?
Yeah, so there's 3 things. The first, and you heard it come through in everyone's story, is believe. Believe in yourself and your symptoms. Too often, women sort of downplay their symptoms, or someone else downplays it, and that could be a doctor. So you have to trust your instincts. I tell them, you know your body, you know if something's wrong. Fight for what you believe is happening. The second is support. You know, Maria Shriver published in her Sunday paper an essay about finding a whistle her mom gave, and said we all need to blow our whistle for help. This is the time where you need support. You need people in your corner to help you go through this, whether it's with getting a diagnosis, asking questions, going through treatment. And then the third thing is, don't be afraid to seek out more opinions. We talked about this earlier, but medicine is not black and white. It is gray many times. And you may see 3 different specialists who give you 3 different diagnoses and 3 different treatment options. So, you know, don't be afraid to go on this journey of seeking care from more than one provider if necessary.
You always say, like, if you're going to the doctor and you've had a bunch of, bring your notebook, or even record. I've recorded on voice memo, because it's so overwhelming. You want to be able to listen to it later and say, okay, what did they say exactly?
That's right.
Ladies, thank you so much. Dr. Narula, thank you too. And for more on getting a diagnosis and to learn more about Dr. Narula's own story, we do encourage you to scan our QR code on the screen. Head to our website, today.com.
Good conversation, just getting started.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.